Hey, y'all. So let's talk vital signs. Okay, as future healthcare providers, it's important that you know how to take somebody's vital signs. It's the quickest way to let us know what's going on with the body without cutting it open, since we can't just cut people open, right? So, this is why we talk about the circulatory system and the respiratory system before vital signs, okay? Because we are measuring vital signs of the heart and the lungs, again, which is going to give us those first indicators if something is going on. So hopefully your lessons over circulatory and respiratory systems, you remember some of this information because you will see blood vessels, arteries, veins, the heart being used while we talk about vital signs. Okay, so before we get started, let's talk about the vital signs. So, what are the vital signs? If you've ever been to the doctor before, you know, as soon as you get in there, it's the first thing that they're measuring are your vital signs. Okay, so what are your vital signs? Usually, this is the part of class where I wait for you guys to give me an answer to see what you remember, but since it's just me talking to myself, I will go through my list. Okay, so the first one is your temperature. Who said temperature? I thought I heard somebody say it. Just me. Okay, pulse, respirations, and your blood pressure. Okay, so these are the four main vital signs that are being measured when you come into a doctor's office or any type of visit. Okay, and depending on the nature of the visit, there is a fifth one that they may ask you, which is your pain scale. Okay, and a pain scale is basically on a scale of 1 to 10, how bad are you feeling? So a 1, you may be feeling totally amazing, you feel fine, very little pain. Okay, and a 10 is I am dying, save me. Okay, this is probably going to be my last breath, not going to make it. So you might have seen the scales with the happy to sad emojis, whatever. Okay, but that is your pain scale that they are measuring. Okay, so for this recording, I'm only going to talk about temperature and pulse. Okay, and then hopefully after this, you can take a moment to try to take pulse on yourself and see how that works out. Okay, so temperature is a measure of your body's temp. And again, depending on what that temperature is, it lets us know how homeostasis is working in your body. If you remember, we talked about homeostasis in general and how different factors can dictate a change in your homeostasis, okay? And fever or lack of is one of them, okay? So these are the areas of the body where your temperature, where temperature is taken, okay? And these are the main areas where temp is taken, okay? So we have your rectal temperature, which is in the rectum, okay? And if you remember from the digestive system where that's located, okay, we have the oral cavity, which is, you guessed it, the mouth, okay? And we have your axillary, which is your armpit. We have your tympanic, which is your ear, and then we have your temporal, which is a scan of your forehead. Okay, and depending on where you take the temperature at, you want it to be in a normal range. Okay, and that range will change depending on the area of the body that is measured. Okay, because some of them are inside the body and some of them are outside the body. Okay, for the most part, the most accurate temperature that is out there is going to be your rectal temperature. And you're probably like, Miss Jones, your rectal temperature? That's kind of gross. Like, they haven't taken my rectal temperature since I was like a year old. And yes, I agree with you. But because it is an internal temperature, okay, it is the most accurate. So it's getting an actual inside temp of what your body's going through on the inside. So that will be the most accurate. Now, the easiest to take is your oral. Okay, again, open your mouth, close your mouth, and it's easiest to take. Okay, now I'm sure you're saying, but isn't the oral temperature an internal? Yes, it is. But how often is your mouth open? Quite often. So depending on external factors, it can change your internal, what you've eaten, how much you've been talking, how much you haven't been talking, etc. So though the mouth is the easiest, it's not necessarily the most internal temperature to take. Okay, you've probably also heard of the axillary temperature. I know my children have that one taken quite often. Okay, but these are the 5 areas that temperature is taken on your body. And again, we are trying to see if you have a fever. Okay, so you want to leave your thermometer. Okay, that is the instrument that you are using. Okay, and if we break the word down, okay, meter is an instrument used to measure. Okay, and then thermo is heat. Okay, so a thermometer is an instrument used to measure heat. Okay, and you'll want to leave these, depending on which one you use, either in that area until it beeps, or you want to leave it 2 to 3 minutes. Okay, so you want to measure for 2 to 3 minutes in order to get an accurate reading. Okay, so if you have a very old-fashioned mercury thermometer, which people don't really use anymore because mercury is toxic. True story, I have a really good friend who has an immuno disease now because of her interactions with mercury. I'll tell you about that later on. But either way, when you are measuring temperature, 2 to 3 minutes in that area, you want to give it a chance to balance out. Or if you're using an electronic one, you want to wait until it beeps. So once again, temperature or measuring temperature is a measure of heat lost or gained in the body. We want to make sure that we keep it at a normal range, which is located here. Okay, that means our body is running smoothly in what we call a homeostatic norm. Anything too high or too low, we know that something is going on inside the body and we need to do further investigation. Okay, my second topic is pulse. Okay, and when you are taking pulse is the measure of blood as it pulses across an artery. Okay, so when it is the measure of blood, let's try that again, of blood as it pulses through an artery. Okay, now a couple of reasons why it is an artery and why we are measuring pulses. Okay, for one, we know that if we bounce back to the circulatory system is a circuit. What it does is blood is pushed through our blood vessels because of the heart. Okay, so that is the pump. That is what is pushing or flowing blood through our blood vessels. Okay, so that is the first thing. That's why we talk about the circulatory system. Secondly, we want to measure if that blood is pumping accurately through our arteries. Okay, and we choose arteries. Why? Because that is blood moving away from the heart. So that pulse is immediately affected by your heart pumping. Okay, veins not so much. They are working backwards. They are going up, back towards the heart. So that pumping is just kind of a secondhand pump based on what is being given from arteries. But arteries are receiving their blood pulses straight from the heart. Okay, so that's why we use an artery. That's why we measure from an artery. Okay, that's kind of a lot. I can go over it later in a hangout if that was too much. But when you are taking someone's pulse, you are measuring the pulses or the blood pumps as it flows through an artery. Okay, and again, the numbers or the pulses are listed in the PowerPoint that's on the classroom. Okay, but the main goal is 60 to 80 BPM. Okay, and this is your average, which is 60 to 80 beats per minute. Or you can say pulses per minute. Okay, so you want to feel between 60 to 80 pulses per minute. Okay, and there is an easier way to do this, but you are going to measure or count how many pulses you can feel at that artery for a minute. Okay, and you will notice here that these are the sites where you can take a pulse. Okay, so temporal is on the side of the head, between like your hairline and your eyebrow. The carotid is in your neck. If you've ever watched any type of doctor show, then they usually take the carotid in the neck before they pronounce somebody dead. Okay, the apical pulse is at the bottom or the apex of the heart. So if I were to draw a heart in, it's not my best one, but we'll make it work. Okay, the apex would be the bottom of the heart. Okay, so the apical pulse is the apex of the heart. Okay, the brachial is, we'll say, in the elbow where your arm bends at. Okay, if you've ever had your blood pressure taken, this is where they put the stethoscope at when they take your blood pressure. That is your brachial artery. Okay, the radial is the most common area where pulse is taken. Okay, it is where your where your wrist flexes. Okay, and it's closest to your thumb. And again, I can show you how to take that pulse in a Google Hangout. Okay, the femoral, kind of a very private area, but it does help to see if you are getting blood flow to the lower part of your body. So femoral sounds like femur. It is taken in your femur. Okay, the popliteal is taken behind your knee, so where your knee flexes. Okay, in the very back of your knee, there's a soft spot. So if you want to take a second to grab behind your kneecap, okay, where your knee is bent at, because I'm sure you're sitting down right now, that soft spot is the popliteal. Okay, the posterior tibial is just like it sounds. Posterior means back. Tibial means where your tibia is located. Okay, so kind of by your ankle, which is where your inner ankle, where your tibia is located. In the very back is your posterior tibial. Okay, and then your dorsalis pedis is on the top of your foot. I like to say where your shoelaces are. So for those not wearing Crocs, for those that have on tennis shoes, your dorsalis pedis is at the very top where your shoelaces are. For those that may be a little more athletic or have smaller feet, you might be able to see those veins and arteries running at the top of your foot, and that is where you'll find your dorsalis pedis. Again, these are the locations for your pulse sites. Again, I will show you how to take an accurate pulse in the Google Hangout. If you have any questions, let me know. My next video will be over respirations and blood pressure.